afternoon, everyone. Welcome to Healthcare in 2020, an MBA for Executives webinar. I'm J.R. Reisner, Director of Admissions and Recruiting for MBA at UCI, and I'm so glad you've been able to join us today. Thank you for taking the time. My colleagues and I are looking forward to sharing information with you, yet before we begin, I do ask three things of you. Please mute your microphone. You may turn your video on or off while we get started, and a little later we're going to ask you to turn on your video and use the raise your hand feature to ask questions. When called upon by our facilitator, then unmute your microphone to participate. This is completely optional. Please engage or listen as you feel comfortable today. We want to be sure, however, to address all of your questions, so please do not hesitate to interact with us. Take a minute also to rename your video if it doesn't display your first and last name. This will tell us who is attending today and will allow our facilitator to call upon you when you raise your hand. Also, throughout the webinar, use the chat box at any time to ask a question. Some of us will be addressing those questions behind the scenes while our guest speakers are conversing with you on the screen today. Now, please allow me to introduce our facilitator, Dr. Ramallah Batra. Dr. Batra is the Chief Medical Officer of Scan Health Plan, a professor at our own UCI School of Medicine, but most special to us, a lecturer for the MBA program here at the Mirage School. She is one of the incredible female faculty members who make us the #1 school for in the US for female faculty. Dr. Batra?
Thanks, JR. Good afternoon, everyone, and thank you for joining us during your lunch hour. I know how busy folks are, so we really are very appreciative of it today. Our goal today is to not only go over what's happening in healthcare in 2020, and believe me, a lot of things are happening in healthcare in 2020, but we also want to showcase and share with you the MBA program in general and the healthcare leadership track in particular, and what kind of skill sets you would acquire if you were to do it. I'm very excited today. We have a fantastic panel of speakers today who will be sharing their insights from faculty perspective as they play a key role in the MBA program. We also have two students who have recently graduated from the MBA program, and they will also share with you their insights as well as share with you what made them join the MBA program and what skills they were able to use. So without further ado, let me kick it off. Jennifer just shared with you a little bit of background about myself. I'm the Chief Medical Officer of Scan Health Plan, which is one of the leading Medicare Advantage plans today, and serves our seniors' lives in general based out of Southern California. I pride ourselves in leading the way in delivering on the triple aim, which is improving outcomes, improving experience, and reducing costs. So very excited about that. I also participate in teaching in the MBA program. I teach a course on business and medicine, and what it entails is sharing what's happening in the ecosystem of stakeholders in healthcare today and how value can be created. So that's all about myself, and now what I'm going to do is I'm going to introduce one speaker at a time, and what I've asked them to do is to not only share their backgrounds, but also share what role they play in the MBA education, and also share what skill sets they feel or what competencies they feel they're incorporating in their courses, or what they have learned during their tenure with us as students that they're applying in daily life that could be of meaning to you. So before I get started, I would also ask you, if you are going to be participating, if you want to turn your cameras on, that would be great. That way I can see everyone. That would be wonderful as well. So without further ado, I am going to go ahead and get started by introducing Professor Chris Bauman. Chris, go ahead.
Hi, I'm Chris Bauman. I'm a research faculty member here at the Mirage School of Business, so full-time faculty. I teach negotiations, which is an elective in the MBA program, and I've been doing that since I came here in 2011. Before that, I was teaching in the executive MBA program at the University of Washington, and I also taught at the Northwestern Kellogg School of Business before that. So I've made my way around, but I'm here for good now. I love teaching negotiations. I think it's an essential skill for everyone, but maybe especially in healthcare. And I also do some consulting outside with different types of organizations, but I've done quite a bit of negotiations consulting with Chalk, with Dignity, with Molina, a variety of different healthcare organizations. So I'm pretty familiar with the industry. I also wear a couple other hats. I'm the area coordinator, which is like a department head for the organization and management area. So I'm intimately familiar with the organizational behavior and leadership courses. I'll talk a little bit more later, but one of the developments in the Executive MBA program, one of the recent developments was the establishment of 3 additional leadership and communication modules. And so my area is in charge of delivering that, those extra skills, which can be so useful in today's workforce. Also somewhat unrelated, I'm the faculty director for our master's program in innovation and entrepreneurship. So kind of busy doing different things, but I love teaching in the MBA program. I think that one of the deliverables that I can provide is just thinking about negotiations as a necessary interpersonal skill. So of course the stereotype involves just buying and selling transactions, but I think that negotiation skills are much more broadly applied than just buying and selling. And so to have a successful career in a large organization, such as healthcare organizations, we really need to be able to advocate for ourselves and for others and find ways to get things done through human interaction. And the negotiation skills are a critical component of that. So I'll stop for now, but I'll have more to say later on.
Thanks, Chris, and you're being very moderate. Chris has also won multiple teaching awards, the recent being this year, so very excited to have you today.
Glad to be here.
Next up, thanks, Chris. Next up, we have Brendan Smith. Brendan's going to give him his little background. He just graduated from the MBA program, so congratulations, Brendan. Go ahead.
Well, thank you. Hi, everybody. I work for Johnson & Johnson in our medical device sector for a division called Ethicon as an area director for the West. And I was really appreciated this program the last couple of years. One of the differentiators for me in choosing UCI was the healthcare certificate program that they had, and also to be among a peer group of about, I think about 25% of our class was healthcare related, but also blended that in with a lot of folks just from various parts of industries, from public, private sector folks. We had it's such a diverse group. And the learning, I think, was optimized because of that. And I chose to go into this program, as I felt, achieving an MBA was a bit of table stakes type of a thing I needed to achieve director level and above in my competitive industry. And that actually has recently worked out for me. I was able to achieve that position and role, and things are looking bright, as well in the future. But some of the key skills and things I learned, I think I learned a deeper understanding of the various stakeholders, from hospital, insurance, other industry folks, patient perspective, and also in the evolving, digital space. As things are rapidly changing. We even were able to pivot during the COVID time period in Dr. Batra's class, The Business of Medicine, and really deeply understand real time what was happening over the last quarter that we went through in the environment in healthcare, and how different companies and payers and providers are responding in this time period. And it gave me some really good insights that I could use within my own organization. But I think there's a lot of opportunity in times like this to really get some real-time experience that'll help us all with our own organizations understand different things. We a couple of highlights as well. We went to Washington, D.C., and had a deep understanding of health policy in the fourth quarter of last year in December. And that was a fantastic experience. We even had a chance to go to the White House. And we also had an extensive trip into China, which helped us to understand, what's happening over there, and bring that global perspective home to us. And so it's been a tremendous experience. So thank you.
Thanks, Brendan. Next, we'll go to Dr. Rika Fable.
Thank you, Dr. Batra. My pleasure to be here this afternoon, and welcome everyone. I'm a relatively new member of the faculty here at Mirage. I am a lecturer in the healthcare track of the Executive MBA program. Previously, currently I'm spending a good amount of time in mental health and working with an organization called Be Well Orange County, acting as the president and chairman of that organization. But prior to Be Well Orange County, I've spent a long and varied career in healthcare and healthcare delivery. A good part of my career has been in the practice of medicine. I'm a physician and practiced medicine for almost half of my career. And the second half of my career was in healthcare management. And I was previously the chief executive officer at Hoag Hospital for a number of years, as well as an executive vice president with Providence Health and Services and St. Joseph Health here in Orange County, and have had many different roles in senior management within the health systems here in Orange County. My particular interest in and contribution to the executive MBA program, I believe, is just that, the varied experiences that I've had. I've had many different experiences that have taught me about the kind of change that Brendan was just talking about, and those kinds of adaptations that are required of leaders going forward. And within those experiences, I think I have much to share to students that are in the program, as well as much of the theory and the concepts on how to execute and how to be successful. I'd like to think that I bring a lot of connections to the program. I am very connected to healthcare leaders around the country, continue to be very connected to organizations, not only in the healthcare provider space, hospitals and health systems, but also in the insurance space and in many other elements of the healthcare community. And so I like to think that I can bring those connections in content and maybe on an interpersonal level as well. And I believe that will be valuable to the contemporary EMBA student who's interested in healthcare. Those connections and the ability to adapt to a transforming and changing environment will be critical. So my pleasure to be here. Thank you.
Thanks, Rick. Thank you so much. We'll move on to Dr. Bhandari.
Hi, good morning. Thank you for joining us. So my name is Tanusha Bhandari, and I'm a radiation oncologist at City of Hope. I also practice at St. Joseph Hospital in Orange. And I recently graduated from the healthcare MBA program like Brendan. And I almost wish I would have done this earlier. It was such a fantastic program, and I learned so much. I wish, a few years ago I would have enrolled. But really, my goal for doing the MBA program is because City of Hope is building a new cancer center in 2021 in Irvine, and I really wanted to be a part of that. I wanted to take what I learned from my colleagues and professors and classmates and be one of the leaders and really learn how to do something like that. And it was a great experience. Like Brendan said, we had the opportunity to go to Washington, D.C. and do our residential there. We were in the White House. We spoke with Peter Navarro, face to face, and Joe Grogan. These are the, policymakers and changes of the world. And it was a fantastic experience. And I really, I'm glad I did it.
Thank you so much, Anuja. Thanks a lot for sharing that, everyone. I think before we move forward, we would like to know who's in the audience amongst us so we can address our questions appropriately. So Jared's going to share a poll with us, which will allow us to understand who's in the audience. So Jared, go ahead and do it. It looks like hosts and panelists cannot vote, but you folks can go ahead and vote so we can see who's in the audience. Okay, maybe another 10 seconds. Perfect. So let's see, Jared, can you display who we have? Awesome. So it looks like we have a few physicians in the audience. We have a few folks from finance, and we have a person from insurance. We also have a few folks from operational logistics. Thank you so much for sharing that with us. Wonderful. Thanks, JR. So if you can move on this slide. So before we get launched and share some more insights, I kind of wanted to share with you the elephant in the room, which I call the COVID pandemic that just happened to happen as we think about it. And as we've been in month 4 of it, as we've been thinking about what the new normal would look like post-pandemic and what kind of insights are emerging, Dr. Don Berwick, who's the leader in the space of coining the word of triple aim around quality, wrote a wonderful article, which I would encourage you folks to read it. It's in JAMA. It's around choices for the new normal. And so I wanted to share a few things that emerged that perhaps in terms of healthcare insights will stay beyond the pandemic in the new normal post-pandemic era. And what he talks about is what a lot of us know in healthcare already, the inequities became more apparent during these pandemics. So I don't know how much you folks have been following. Me, from where I sit, when we look at our data, people of color, people who have lack of access, have had disproportionate share of COVID that happened to them. The second insight that emerged was speed of learning. If you're in healthcare, it takes about a good evidence-based practice about 10 to 15 years to become the normal practice. But what we learned in this pandemic was things happened really fast. Very quickly we adapted to the changes. Very quickly we were able to deploy certain things. That is going to be there to stay, hopefully. The value of standards, there's a huge variation if you look at care that is provided based on geographies, based on specialties. And what we saw was folks were leaning more and more towards standards. CDC suddenly became so apparent. Everybody was looking on a day-to-day basis to see how standards were changing. And not only were we looking towards CDC, we were looking at our friendly competitors to say what they were doing in terms of protocols. That is another thing I'm hoping would stay. Protecting the workforce. All of us really quickly decided who could work remote and who could not, and how can we protect the first responders. The hospital systems tried to act really fast, tried to secure the PPE. For folks like me who are in administration, we worked very quickly to deploy digital tools. The school did the same thing too. In fact, when I taught the course, 100% of it was on Zoom online. So we were able to do that and keep our workforce protected. And as we go in the future, there's going to be a more push on that as well. And I think one thing that emerged as a front runner was virtual care. It didn't matter where you were, who you were. Suddenly, we were all trying to provide care, whether it be through a video platform or through an audio platform. And if you look at from my perspective as a primary care physician, what I noticed was we suddenly became person-centric, consumer-centric. We were setting up tents and drive-thrus and texting people and using audio visits and video visits. Heck, in our practices, some of our practices, we're not dropping off virtual iPads to people's homes so they can have tele-video visits. And I think virtual care is here to stay. And one of my colleagues said it was during the pandemic, there was emergence of 3 Ts, Twitter, TikTok, and telehealth. And so that's a good adage to kind of remember as well. And last but not the least, there was once again an awakening around preparedness for threats. While we were learning on this threat, there's going to be hopefully more focus as we move forward in the new normal in getting us even more prepared for threats like this to come in the future. So once again, these are the kind of insights that have been emerging around these kind of pandemic times. So I wanted to share with you, it's a good, useful, quick 1.5-page read that if you are interested, you can always read on it. So this is just to get our juices going and getting started. What I want to do next is to kind of start posing questions to the folks in the panel. While you folks think about your own questions, and I'll keep monitoring the chat to see if anything gets asked, I'll ask the panel. Dr. Fadli, perhaps we'll start off with you. You have had a varied background. You have led multiple healthcare organizations, some very complex, very varied. As you think about what's happening in the pandemic, what are the insights that are emerging from your viewpoint, and how or what skill sets do you think the incoming MBA class or folks that are interested in MBA need to develop to prepare themselves for these emerging trends and insights?
Yeah, the article by Berwick is very insightful and provides a lot of very good framework for many of the changes that we are seeing. And I think the thing that I would comment on, and you commented on it as well, Dr. Batra, which is that the speed of change is unprecedented in our industry. That's not to say that change didn't happen, but the speed by which it occurred has never been like this. And as we say, invention is the mother of necessity, or necessity is the mother of invention. And there certainly is a necessity that was perceived and real as it relates to the pandemic. So one of the things that is important is for individuals working in the healthcare field, that there needs to be a lot of ability to change quickly, understand the concepts of change and adaptability as a necessary skill. We used to like to think it was about learning deeply and beginning to build a way and a method, and you would apply that method consistently over a longer period of time. All of that has changed. The ability to adapt and the adaptability capacity of individuals. And so that's something in the course that I'm just going to be beginning here coming up next week on strategic management of the healthcare enterprise. One of the things that we are going to stress to a great degree is adaptability and understanding of the important nature of the ability to adapt to change and to embrace that, but also to lead that. And that's new. That's new in healthcare, and maybe it's about time.
Perfect. Thanks for sharing that, Rick. I absolutely agree. I always complained it took us, from a personal experience last year, the entire year, we must have done 800 telehealth visits for over 250,000 members. Fast forward to this year, 30% of our visits are either video visits or phone visits. And people just bootstrapped, created whatever needed to be created. And I'm not kidding when people are dropping off iPads in people's homes so that they can have video visits. So never seen a change happen so fast, so hopefully that will stay on. So thank you for sharing your insights. Tanuja, my next question is for you, and I would love for you to do the same. You have an oncology background. What are the insights that are emerging from the hospital delivery system oncology practices? And also share with us, what do you think you learned in the school that you could apply to address those emerging insights and needs?
So a great question. So I think the first part of the question is, what can I apply that I've learned? And, there's so many classes that was part of our curriculum for the healthcare program. For example, negotiations. I wish I would have, like I said, I wish I would have taken this years ago when I was negotiating my contracts. And it was a great class, and thank you, Chris. But really, how to navigate through the healthcare system. And that's something that I never really learned in medical school. I didn't really learn the business of medicine. I learned how to take care of patients and how to treat oncology patients, but I never really learned how hospitals run or what to look for, what a triple aim was, simple things like that really put things into perspective. And I think it makes me a better healthcare provider, knowing what to look for, what are standards of care, why do we have these policies in place? And, like I said, our DC residential was instrumental in learning in those aspects. We didn't have a telemedicine program here at St. Joseph Hospital. And over the last 3 months, we implemented telemedicine, virtual visits, did a lot of the oncology follow-ups, virtually. And it was literally overnight. It's something I didn't think that could be done, but our team came together, the physicians, the other ancillary staffs, the nurse practitioners, IT, and we made it work. And that was incredible to see something that went from 0 to 100% functional in about a week's time. And so for me, I'm really proud of that, to see that I could still see my patients and still communicate with them. They were safe, their families were safe. And that was really rewarding to be a part of that. And I think that's all I have. I hope that answers your question.
Okay. Yeah, no, thanks for sharing. It appears, having done the program myself, one of the highlights of the program was around the DC residential. Maybe continuing with what you just shared, could you shed one or two things that in DC residential that you found very appealing or attractive that kind of led you in learning more or applying those skills?
Right. I think each class, you learn, your top 5 skills and you apply them. And I have to say, I am really thankful that I know now what I know, because I think I'm a better clinician because of that.
Perfect. Thank you so much for sharing. We'll go to Chris next. Chris, I know you teach multiple MBA courses. You just shared with us the negotiation course. Healthcare is going to change dramatically in 2020. And when I say change dramatically, not only about delivery of care, but also reimbursement for care is going to change. You know, there'll be more folks in Medicaid roles. Reimbursement's going to shut down. We are already hearing about a lot of layoffs, a lot of contracting that's happening. What skill sets in your courses do you teach the students to adapt to the changing environment from that perspective?
So to answer that, I'll try and draw some parallels to what Rick and Tanuja said. Is, you know, Rick was emphasizing how the program helps people understand how the industry is changing. So at the broadest level, and Tanuja mentioned how the program can help people understand how organizations work. And what I try to do in my course, and I think what my area, the organizational behavior area, tries to do is emphasize on what individuals can do to handle these changes. So we've got 3 different levels of analysis that the program helps to prepare students for so that they can navigate their career. In my course, we walk through on a session-by-session basis a careful analysis of the structural elements of the situation. So what are the recognizable pieces of the situation that we can use to identify the most successful tactics that we can deploy to help us get what we want and to help other people get what they want as well. And so to talk about your own career trajectory or to talk about renegotiating contracts, things like that, my focus is really at what people can do to prepare for a negotiation so that they're aware of the playing field and the obstacles and the opportunities that the playing field provide. And then specifically in concrete ways, what do I say to try and get my point across so that I can lead my counterpart to a mutually acceptable deal that will help us both get what we want. And so I think that a lot of people, in fact, the vast majority of people that I've met over the years at all levels of experience tend to conceptualize negotiations as this really competitive situation. And it doesn't need to be that way. It doesn't need to be scary. It doesn't need to be off-putting. When you have enough comfort and faith in your ability to anticipate what's coming across, a negotiation or really any interpersonal interaction is an opportunity to find common ground so that you can get more of what you need and I can get more of what I need. And so to the extent that change is going to be an increasingly rapidly accelerating, but increasingly part of today's workforce, maybe especially in healthcare, we're just not going to have the luxury of relying on well-established systems where a template is going to apply over and over and over to similar situations because the situation is fundamentally changing. So, people in the healthcare workforce need to be agile and need to understand how do I advocate for what I think is best, whether it's your own career path or whether it's on behalf of your organization and securing the contracts and relationships that are important to the organization's success. So in my class, we really try to analyze at the individual level, what can you do? And Tanuja and Rick already mentioned how other classes give you the tools to think more broadly about the organization or the industry alone.
Right. Thank you, Chris. Thanks so much. I know there's a question, so I'm going to have Richard. I believe Richard has a question. Richard, do you want to unmute yourself and ask a question?
I'm not sure he's able to do so.
Okay, I can read off his question. His question is, some of the concerns I have regarding healthcare during this tumultuous time, by the way, great panel, thank you for that, is the healthcare delivery system represented in this panel is great, but there is, sorry, I'm not reading the question correctly. Smaller, less money delivery systems have less resources to provide services and don't have the financial cushions. Furthermore, many of the population it serves does not have the resources to actively participate in the care. So I guess the question is, if we have limited resources and if we are small in nature, what can we do to kind of get beyond these tumultuous times? So I'm going to open it, see if anybody wants to go first. Rick, you want to go first? Go ahead, Rick.
Yeah, sure. Good question, Richard. Thank you for asking it. Variability in resources is nothing new in healthcare and healthcare delivery, especially from the hospital and the physician side. There are other elements to it as well. But variability in resources has always been a challenge. For example, 51% of hospitals in California have less than a 0% operating margin. Okay, 51% of hospitals in California lose money on an operating basis. And I think maybe you were referring to some of those organizations that have those difficulties. So how do you get things done? Well, one of the important elements that is happening in healthcare today as it relates to hospitals and health systems is the whole area of consolidation, as well as convergence and partnership creation for purposes of driving resource efficiency and better use of resources, but as importantly, access to resources. So lesser organizations, let's say inner city or rural would be two examples, are increasingly partnering with other organizations and organizations that aren't like them, like health plans, as an example, an area that Ramallah works in the insurance side, and partnering with them in order to make resources available and to get to what Professor Bauman told us about, which is what's the win-win position that can be beneficial to all the stakeholders that are involved. So what is required of leaders is to not complain about what they don't have, but rather find out what they really need, because oftentimes we don't need things. We want things, but we don't necessarily need, but find out exactly what we may need in order to serve our mission and our goals, and then find methods and ways by which to make that happen. And there are many new ways by which that can occur. Partnering with organizations that maybe don't even seem like it could be partnering opportunities is something that we're seeing more and more in the field now.
Thanks, Rick, and you're absolutely correct. We see a lot of consolidation, not only horizontal consolidation, but we're also seeing a lot of vertical integration to create those kind of systems, to truly create a system, not only to be efficient, but also to be cost effective and also to be more member person centric and aligning goals. I think that's the other thing which is emerging through this all is how do we align all the goals and the incentives. So I can share an example from my experience from where I sit, like social determinants of health is certainly a buzzword. It's not that we suddenly discovered that poor housing or poor nutrition or poor access to care will lead to worse outcomes. It's because there are opportunities right now to create those aligned incentives around value-based care where it suddenly makes sense to provide these kind of things to prevent more downstream worsening outcomes like poor diabetes and things like that. So you're absolutely correct. There is a lot of vertical integration happening and also tools to kind of target the right populations in the right way. I think that's the second thing that has been emerging is if I have limited resources, instead of spreading it all out, who are the populations that I need to serve the most and what will help them the most to improve outcomes? That's the other thing that is emerging. So thank you for sharing that. Okay, perfect. So we'll go on to the next. I didn't see any new questions. So I'll go on to Brendan. Brendan, you work for a pharmaceutical industry. There's a lot happening. We spoke from the delivery system side, from the provider side, from pharmaceutical perspective. What insights are emerging, and how did your skill set help you in kind of tackling those insights and being there to make use of the opportunities? As Churchill said, if there is a crisis, do not waste it. So how are you not wasting it to do furthering your agenda and kind of delivering care and things like that?
Wait a minute. Before you answer, Brendan, don't you make baby powder? I thought you made baby powder.
Apparently, they no longer make regular baby powder, just a cornstarch version of it.
Okay, I just wanted to get that clear. So
yeah, baby powder is less than 1% of J&J's overall revenue, but makes up 90% of the news. But yeah, And so hopefully that's behind us now at this point. But this program, and I guess also just to touch on what the last person had asked in the question, from my perspective, sitting in the room would be the network too. You know, the network of folks that you can tap into to help you answer those questions for your organization, whether it be the faculty or alumni or the folks that are in your classroom with you right then, that are experiencing similar things with smaller organizations, or I saw some things about the labor questions and all that. I think there's a lot of opportunity to tap into different, you know, spheres and circles to understand. You know, from my perspective, I mean, my ability to zoom out and zoom in, similar to what Professor Bauman had mentioned on the levels of analysis, really helped me out, you know, quite a bit. And I think that not everybody around me in my organization has that ability. A lot of people are focused on the task ahead of them and keeping their head down and don't take the time to necessarily always zoom out and then be able to zoom back in on it. So I think that that's been very helpful to understand the you know, the foundational business, and then also explain to folks, you know, in my own organization what I'm seeing happening, you know, at this time during COVID, you know, the time period where we were in Dr. Batra's class last quarter, and things were very real happening in March and April, and being able to go back to my organization, explain to our folks at the very high levels within J&J what we're seeing out here was very insightful, especially considering that things are very murky in this time period, and especially with people holed up in their own homes and not having the same levels of information that they would have had in the past. It's been very helpful. But also the trip to DC as well, as far as, you know, the insights I touched on earlier, the different stakeholders, but really understanding how healthcare policy created the different concessions, understanding lobbyists, speaking to actual lobbyists. I got to spend a lot of time with the J&J lobbyists back in DC as well, and that was very valuable for me. But also to get a better understanding of what's happening with newer, you know, asymmetric competitors like CVS, Aetna out in the marketplace, and see directly from them what they're looking to do and what their vision is, were also very insightful. So, anything else, Dr. Batra, that you're looking for?
No, this was very helpful. Thank you for sharing that. I think before we move on to the next set of questions, I think we had another poll, and what we wanted to find out from the folks who are attending the webinar and what their interests were as they're exploring EMBA, so the school could meet their needs. So maybe JR, if you can share that poll, that would be great. So what are your goals in pursuing an MBA? And as you can see, there are multiple choices there. So we'll give everybody maybe a few seconds so they can answer. Okay. Looks like all of you agreed on one thing, which is great. Increase my business knowledge and skills. Wonderful. All you have to do is attend Rick's class in that case. Expand my network. A third of you are saying that. Promotion, income, so personal career goals and things like that. And looks like there are a few folks who also want to have entrepreneurial endeavors. So that's great too. Thank you for sharing that with us. So I think what I'm going to do next is open up a general question for the panel, and feel free to ask questions as I open up. But sitting from where we are and what's happening, we are in month 4 of pandemic. Rick, you're absolutely correct. I was shocked to hear that most of the hospital systems had like 60 days or 90 days of cash on hand, which was a big surprise and shocking to some extent. But what I wanted to also see is, you know, as things are changing, not everything should be doom and gloom. There always will be opportunities that emerge. What opportunities do you see are emerging during this pandemic that folks can start thinking about, especially as people are thinking about entrepreneurial endeavors or starting new programs? What advice would you give them? Maybe Rick, we'll start with you, and maybe we'll go around the panel.
Well, as we talked about earlier, an event like the pandemic has caused a great need for adaptation, and telehealth is a perfect example that was mentioned. Within any adaptation, with any change that's happening, there is going to be need for not only structure, but also process change. So structure and process. And so structure, an example would be a technology. Or a process would be, an example would be in the use of technology, the use of data as an example, the use of what we're doing right now. Think about the explosion of this kind of communication that's occurring. And oh, by the way, it's working pretty well. I mean, I'd rather be with all of you, but nevertheless, this process is working, and it's working pretty well. So there is a great opportunity from a business perspective for many of the elements of the necessary adaptations to a changing environment. In this case, being an example would be the need for caring for patients remotely creates a great need for adaptation, and there are structures and processes that have to change. Entrepreneurs will address and will embrace those kinds of adaptations as business opportunities. So those of us who have an entrepreneurial line of thinking and are innovative in your nature of thinking, this is a great time to not only know that it's needed, but it's one thing to know that something is an opportunity, is one thing to know that there is something there that could, a need that could be filled. It's another to actually be able to act on it. And one of the things that we do in the MBA program is to teach students on the processes necessary in order to do good business planning, as an example, in order to execute and to understand the connection between strategy and execution, and to know how important and vital that is. So I think by adding the educational piece, which 100% of our listeners today want to acquire, that increasing knowledge and education, but then it's the application that is so vital. And in a time of change, there is no greater time for an entrepreneurial behavior and spirit, and the opportunities that can occur there.
Yeah, I'll jump in on that if you don't mind, Ramallah. So any disruption creates an opportunity for entrepreneurship. I mean, Rick is exactly right. And so COVID is just one example, let alone all the regulatory changes and everything else that's happening in healthcare. I mean, the industry overall has changed and created opportunities for entrepreneurs. So more broadly, in addition to the standard part of the executive MBA curriculum, where there are lots of opportunities to understand entrepreneurship, the Mirage School and UCI more broadly is positioning itself to really help people interested in going alone by providing a host of different resources and knowledge to fuel new ideas, because at the heart of the Orange County economy is a lot of entrepreneurship. So I mentioned in the introduction, I didn't know if this is going to be relevant. I'm the faculty director for our Masters of Innovation and Entrepreneurship program. It's a one-year degree program that's largely aimed toward people relatively little experience, so a younger crowd than what most people on this call are going to be geared toward. However, the school is supporting that program with a whole array of co-curricular events. These are webinars and discussions, or hopefully for not too long from now, in-person sessions, primarily offered on the evening or on the weekends, so working around professional schedules, where people interested in starting a business, figuring out how to create a new business model, somebody with an idea, or somebody wants to partner with people who have ideas. The Mirage School is creating an exchange of sort where people have that opportunity to hook up with each other. This also helps prepare students to enter an incubator that the Beal Applied Innovation, another unit on the UCI campus in general, which is tasked with fueling entrepreneurship in Orange County. Healthcare is a large part of that. So there are any number of connections that people can make through UCI and through the Mirage School more broadly, not just isolated within the executive MBA program. And so, yes, change is real, change is rapid. And if people have ideas, the school and also the university at large is prepared to help people develop that. Or if people are interested in just dabbling or putting a foot outside of a large organization and exploring what going on your own might be like, we can definitely help people envision that process.
Thanks, Chris. And I would also add to it, between what you said and Rick said, is in addition to acting to the change, finding the innovation opportunities, there's also the links to the health policy, what's happening in the policy environment that makes the entrepreneurial endeavor like reimbursable or real, so you can act on it and actually get paid. So telehealth is a good example. Like if you look at telehealth 6 months back, you could only do telehealth if you were in certain rural areas to get reimbursed for it. And fast forward to now, telehealth is getting reimbursed at the same rate as it would be for a face-to-face visit. And moving forward, the policy changes making it almost permanent so you can continue providing those kind of visits. So creates a big, huge opportunity in terms of not only doing those, but setting up the processes. So it is more person-centered and people can engage with it. Interestingly enough, as we are launching our own telehealth strategy, what became apparent is there is no education or curricula in how to conduct a good telehealth visit. And so we were joking that there is an opportunity right there for somebody to create a curriculum on how do you do a physical exam on a telehealth visit? How do you engage with a member or a patient on a telehealth visit? So those are the things that kind of become apparent, but then you can put your insights into action with these kind of programs. I'm going to go to Brendan and Tanuja. Anything else you guys want to add to it in terms of opportunities that you see in the environment right now that perhaps you can act on?
Go ahead, Tanuja, if you had something. You're on mute.
I think you're on mute.
Okay, can you hear me? Okay, yeah, I think you touched on it pretty well as far as telemedicine goes, and I think it's really important that moving forward we continue to improve on our telemedicine and how we see patients and how we care for them. I know that we didn't have a program initially, and literally within a week to 2 weeks we had to create something. So a lot of us had to get creative and see how we can do the best that we can, and now we're improving things daily. Better resources, better communication, and with the cybersecurity systems that we have in place, I think it's a huge opportunity for growth. And I think it's going to be part of our way of life from now, especially when patients are sick and they can't come in and, they're getting chemo or radiation and, they're just not well enough to come in. We now have this new modality where we can take care of them, from their home, keep them safe, keep them, out of the ER, things like that, and have a new way of life, really. So I think that's a huge opportunity for us in the Cancer Center.
Thanks for sharing. I see a question. I think Sandy's asking a question. It says, as digital engagement evolves in healthcare, what does the panel see as emerging technologies to support digital engagement? And also, what parts of the EMBA program would support that? So I'm going to open it. Anybody who wants to go first. So how is digital engagement evolving, and what do we see as the emerging technologies to support digital engagement? So engaging with technology, telehealth, and those kind of things.
Yeah, well, at least from our perspective, a lot of patients who weren't, iPad savvy or computer savvy, I think they've really grown a lot to become, and their children are teaching them, their, family members are teaching them how to engage and how to connect with the physician. Obviously smartphones and, all the smart devices that we have, I think patients are more engaged. And I think, moving forward, I think that's going to be a great part of the way things are done. And, we also have our ancillary stuff, so they can see, nutritionists, they can see, a wellness coach. I mean, there's just so much opportunities for patients and healthcare to be delivered, So I think it's a great opportunity for all of us to learn and continue to improve.
I think with
thanks. Anybody else?
Another perspective on for that question. There's not going to be just one technology. I think you're looking at a very disruptive marketplace, and you're looking at patient workflows that have been completely disrupted, and some things will go back to normal, but a lot of things won't. I think the opportunities lie in understanding the customer unmet needs and all the different stakeholders, and what things can, how technology can help people take cost out of the system. And I think that there's not like one technology. Yes, we can all pinpoint that telehealth, a lot of opportunity, but with telehealth, how can we reduce people from visiting different brick and mortar sites, and what types of wearable technology, diagnostic technology, other things that'll keep patients from having to go in, preventative things. And I think, what is UCI doing? I mean, they're leading with digital in the digital transformation, focus that they have right now in the course, but they also teach you the fundamentals of understanding customer and needs, patient needs, market needs, marketing, and all the other different courses as well. So I hope that helps.
Thanks. Rick, you have something?
Yeah, some of the work that we've been doing in mental health is a good example of where the technology and the digitization of care processes is making and will make an ever increasingly significant difference. Much of mental health services can and should be done in remote sites. To Brendan's comment, the emergency room nor jail are the best places to conduct mental health services. And even addiction services are best not done in halfway houses and detox centers. Home, and sometimes for many of these people, home is on the street, is a better place. So think about all of the remote technologies that can be done and can be developed and used. And some of those already exist. And one of the biggest challenges, and I like the question, I appreciate the question very much, because one of the big missing elements is interoperability between these multiple things that we are creating. So we have a lot of wearables, but they don't really coordinate with anything. And we have some mobile apps, but they don't really inform anything. And so developing that interoperability is a key. And I would like to think within the healthcare track of the EMBA program that we would have the ability to begin to bring some of these strategies together to get the minds of the end users. So I think about Tajuna, I think about Brendan, their end users just recently graduated. I'm excited to think about what are they going to do with what they just learned. What are you going to do with what you just learned? And I know that it's going already. They're already thinking about all of those things that can occur. Our job, Ramallah, you, me, and Chris, is to make sure that they get all of the tools that they need and get the basis for the need so that they can then, we enable them to really take what they learned and to turn these into things that are going to make a difference. And I think in the digital space and that interoperability between those digitizational functions, those digitized functions, is a tremendous opportunity. We hear about AI and we hear about a lot of those sorts of things. It really comes, the rubber on the road is, how does it improve the health of people or communities? And it requires end users to be able to develop that. You can't get that from an engineer type or from a developer type. They have to have end users to really design how healthcare improves the lives of people. So that's what the healthcare track of the EMBA program is all about.
I think you bring forward a good point, is you have to ask the right questions as well to be able to answer them.
Of course.
And it gives you a structure, a format of thinking. So you ask the right questions, you can answer them. And veering off a little from the point, as we think about digital engagement, let's not forget inequity in the digital divide, as I call it. 2/3 of the senior population, in our experience, is still not using technology. A proportion of it is not using it because perhaps they're not comfortable. They're used to the face-to-face visits. How do we empower them so they become comfortable in using it? And I think that goes to, how do you make it easy and easily understandable, more patient-centric? But then there's going to be another half who would still need that human touch and also may not have capability or resources. So what do we do for them? It goes back to, how do we improve the health for the communities? So I think the bigger question is, how do we improve the health of the communities? And how do we then also get people on board who perhaps were skeptic at some point? We just did a survey and we asked people, hey, why are you not using technology? And there's a small proportion that said, I don't feel comfortable, I have not used it. But then others said, I like that face-to-face contact with my physicians. That for me is a social visit. So there are higher level things that we also have to think about, social isolation being one of them. So let's not think about, I tell everybody, let's not think about it, high tech, low tech. Is the right technology and the right touch. For some, it'll be human being touch, and for some others, it'll be high touch, high tech and digitization. So absolutely correct on that. Okay, perfect. So I think this was really good. We had a good exchange of ideas, and thank you for raising all those questions and participating. I would really like to thank everybody on the panel for coming and sharing their ideas and spending the lunch hour with us without any lunch. These are unusual times, right? We're working during lunch hours, a lunch meeting, but no lunch, so hopefully you get some. So thank you for that, and I'm going to hand it back to JR, who can do the closing for us.
Thank you so much, Dr. Batra. I do have to thank all of our panelists. Having our alumni share their stories with you is an incredible opportunity. Hearing directly from faculty, it's easy right now for me to arrange a virtual class visit for you, but it's not easy for me to walk you down the hallway and introduce you to our faculty. So I want to thank Dr. Afable and Professor Bowman as well for joining us. Before I do let everyone go, and we're going to wrap up very quickly, I just wanted to point out that we have an application deadline coming up here on July 1. If for any reason you don't think you can make that deadline, I would be happy to speak with you about alternative options. We're quite accommodating in EMBA. But I want to also point out that you do not have to take the GMAT or GRE at all during the admission process, not just by July 1. We actually very critically look at and examine your qualifications through your prior education, what you're doing now, and what you've contributed in your field. So we're not going to look at testing from years ago, but we are going to look at what you're doing now. And then if you've enjoyed today or you just want to know more about us, please consider joining us on July 11th. We will be having a virtual preview day. It's basically an open house online where you will hear a keynote address from a professor, and then you will have the opportunity to break into rooms to hear about the various MBA programs available here at the Mirage School. I will be reaching out to each of you, thanking you for participating today and joining us. So at that time, you'll have the opportunity to be able to make an appointment with me to talk about your specific interests, goals, and the best next steps for you. I'm going to check the chat box very quickly to see if there are any more questions. Not at this time, so I want to thank everyone for joining us on the webinar today. Have a wonderful day and be safe.